Good evening and welcome to this educational webinar, Allergy Expert in Action, Alexa. This webinar is supported by Nutricia Specialized Nutrition. It has been accredited as 2 hours of continuing medical education by the Dubai Health Authority. Attendee certificates will be sent in the coming days. Since this is a CPD accredited event and as per the accrediting organization requirement, please note that credit certificates will be provided only to those who participated fully in the activity and completed its requirements. If a participant failed to attend the activity in full, then he will not be eligible to receive credit points assigned to that activity. The webinar will take the format of 2 individual presentations. These will be delivered by our guest speakers, and each presentation will be followed by a dedicated question and answer session. To submit a question, please use the question tab that you can see on the right of your screen, and you can submit the question during the presentation. To start the webinar, we would like to welcome our first speaker, Dr. Mohammed Migdadi, for his presentation, The Gut Microbia and its Role in Early Life Immunity and the Development of Allergic Disease. Dr. Migdadi works as the Division Chief, Pediatric GI, Hepatology and Nutrition Division at Sheikh Khalifa Medical City in UAE. It gives us great pleasure to welcome Dr. Migdadi to join us for this event. Up to you.
Good evening, everybody, and hope all are doing very well. Normally, when we start a presentation, we say thank you all for coming, but I will say thank you all for registering tonight. I see good enthusiasm. There is 417 people who registered already. And this is going to be, I think, the new way of doing scientific presentations in the future, at least in the coming several months. I was asking Nutricia, our sponsor today, how the dinner will be. Normally, we have dinner of presentation. Maybe in the future, we'll have like an order or deliver through Zomato or something to send us the dinner to home. Without any further ado, I will be happy to talk to you tonight for the coming 30 minutes about the role of the gut microbiota and specifically the role in immunity and allergy development. Throughout the presentation, I will have several questions to make sure we keep some format of interaction from this talk. Some of the questions, actually, I'm not sure if I know the right answer, but it will be a good way to communicate with each other. Please feel free to put the comments there where it says chat, or you can put your question or comment, and I will be able to respond to you. It's a bit interesting that you guys can see me, but I cannot see you well. So I think most of you are probably sitting at home very comfortable. Probably you're in pajamas or shorts or t-shirts or whatever. I have to wear a suit, well, at least in the top part, to be more professional. All right, so the outline for the coming 30 minutes or so will be why allergies in infancy are still important, and the second part will be risk factors for allergies. Then we'll discuss in detail the gut microbiota and the dysbiosis and allergy, and then we'll talk about how can we do some immune modulation through the pre and the pro and the symbiotics. My fellow speaker, Dr. Meyer, will talk in more details about the clinical applications, and she will share with us the studies that have been published about the role of the pre, pro, and symbiotics in allergy prevention as well as in allergy treatment. So the first question, just to get you all started, let me ask you this question. Are allergic diseases and asthma, are they risk factors for the development of SARS-CoV-2, which is the COVID disease infection? If you believe this is a yes, click A. If you believe this is a no, click B. Let me see. I think I should click where it says pause. Is that right? Where can I see the results, Helen? I don't see the results yet. In polls. Yeah, I'm in polls. It's
all the way up.
See. Oh yeah, it's a bit two lines. So 74% says yes, 25% say no. That's a very good response. Unfortunately, I don't think that's correct. The correct answer is no, and that's a good news to our patient. I'm referring here to a publication that was published very recently, just like a month ago. Of course, it came from China, Wuhan, and they looked at the clinical characteristics of 140 patients with SARS-CoV-2. And moving to the table, as you can see, I picked this part of the table where it says asthma, allergic rhinitis, food allergies, atopic dermatitis, drug hypersensitivity, urticaria. As you can see, there was no difference between the severe and the non-severe patients, and the authors have concluded that allergic diseases and asthma are not risk factors to develop SARS-CoV-2, which is very good news to our patients. I have a lot of patients who have allergies, mainly asthma, who are worried about this, and according to this in recent study, it's not. It still continues to be the age and the number of the number of other comorbidities that increase the risk for that. So please reassure your patients with allergies they have the same risk like the general population when it comes to SARS. Cool. All right, as you can see in this slide to the left side, that allergic disorders are very common. In this few publications, it was noted that 10 to 40% of the population around the world, they have some sort of allergic disorder at certain point of their life. And up to 40% of the children with atopic dermatitis, they have a specific food allergy. Cow's milk protein allergy is probably the leading cause among all the food allergies. Expected that in the future we'll have more and more patients suffering from allergy, and we'll try to see why that increase is probably gonna happen. At the far, I would call it right side of the slide, you can see as the prevalence of allergies are increasing with time from 1950s up to 2000, you can see a mirror increase in the other autoimmune disorders or the idiopathic disorders, let's call them, like type 1 diabetes, Crohn's disease, and multiple sclerosis and alike. So it's really thought that this increase in the allergic disorders can increase your risk of having these autoimmune disorders in the future. And this is why it's important, if we can reduce the allergies, hopefully we can decrease the incidence of these disorders later on in the adults. And it has been described that allergies in childhood is the first detectable immune disorder we can detect in human life. Exactly. So let me ask you another question, and this is a very specific question. Do you think that the prevalence of food-induced anaphylaxis, i.e. severe allergies, please click A if you think that the risk of the prevalence of anaphylaxis is increasing, click B if it's decreasing, click C if it is the same. Okay, let's see the vote. Excellent. So I think most of us in this group, we believe that the anaphylaxis reaction, severe food allergy, is increasing. 70% of you said yes, and that is very true. I'm referring here to this study that was published in Italy. They looked at the patient admitted with severe anaphylaxis between 2000 and 2011. As you can see, the number of patients being admitted with anaphylactic reaction is increasing over time, whether this was in the younger patients, in the dotted lines, the preschoolers, or the schools. Both of them are increasing. What's interesting in this study also to notice that the allergy persists. If you can see in the red dotted line, these are the children from 5 to 14 years, you can see that allergy persists even after the age of 5, i.e. in the schooler children at that time. Perfect. All right. What is the burden of allergy on a patient? It's not only the physical symptoms by itching and being uncomfortable or have a cosmetic effect. Probably it goes beyond that. As I showed you earlier, that if you have allergies in childhood, there is a chance you might develop other autoimmune disorders later on in adulthood. We mentioned multiple sclerosis, the Crohn's, diabetes, and others. Also, there is a financial burden, as these parents have to pay fees to go to see the doctor, buy certain medications, buy specific kinds of food, avoid certain kinds of foods, or milk intake. This would increase the burden as well. Obviously, there is a psychological effect as well, especially if it appears in areas that's seen, like the face, or when somebody touches their skin, they feel it might be a little rough. In extreme cases, it might result into isolation and fear of the future health problems in some of these children, or actually maybe even teenagers as well. All right, so that try to explain to you the importance of allergies in infancy, and hopefully if we can prevent that, we can improve their future adulthood life. Let's move on to talk about the risk factors for allergies. In this slide, I have put together from several publications different kind of risk factors. Obviously, the family history is an important risk factor, and if you have one parent with allergy, this would increase your baseline risk of allergy by several folds. If both of the parents are allergic to the same thing, you are almost certain that the child will develop that particular allergy. But also remember that even if none of the parents have allergies, still the child might develop allergies, even if both of them do not have any allergies. The second factor is the way of birth. If a baby are born by C-section versus vaginal delivery, they are at risk of developing allergies due to different factors. The use or the abuse of antibiotics might increase your risk of allergies, and several studies have shown that the children with more usage of antibiotics, they are at higher risk of developing allergies. Both of these factors, the C-section as well as the antibiotic abuse, definitely is a concern, and the most likely mechanism that is through changing the microbiome. We all know that babies born by C-section, they have a totally different microbiota than children who are born vaginally, and definitely children who take antibiotic courses, their microbiota are going to be altered probably for several weeks, if not months after that. Also the pollution, as you can see, people who live in polluted area, they are at higher risk of developing allergies. All right. And this was mirrored by several studies after that. All right, this is the world map, and they're talking about the percentage of women who deliver by C-section. If you can look at the left side of the curve, these are the overuse of C-section, and at the right side, the darker color is the underuse. And there is obviously most of the countries, or the developed countries, they are overusing the C-section, and this will definitely affect the microbiota of the child, and thus increasing their risk of developing allergies. All right. In this publication, they looked at the odds ratio, i.e. the risk ratio of developing allergies, and they looked at patients with C-section versus children without C-section. As you can see, the risk of allergic rhinitis increased, risk of asthma has increased, the risk of celiac disease, diabetes type 1, and so on and so forth are increased in patients who are born by C-section versus by patients or children who are born naturally. All right, now it's time for a question. Let me ask you the third question. During this time of this COVID and quarantine and what they call it social isolation, this is an intriguing question. I want to ask you, do you think social distancing may increase the risk of allergies? If you believe that's the case, then click A. B, does lockdown increase your risk of allergies? And C, routine use of PPI may decrease your risk of latex allergy among healthcare workers. And the last option, which is D, the use of disinfectants does not disturb the human microbiota. Which one of the following is true? I will wait a second to see more people. All right, excellent. We have an excellent audience here. Let's go to A. A, where it says social distancing may increase the risk of allergy. Many people believe this is true, and I think that's probably true. I don't have any publication about that, but it's well known that children who are the only child for the family, they are at higher risk of developing allergy versus children who have multiple siblings. Also, if the child grew up in a farm and exposure to other antigens early in life, they are more likely to develop allergy. So probably social distancing will increase the risk of allergy because these kids, they will not be exposed to allergy. B, the lockdown may increase the risk of allergies. Probably lockdown may decrease the pollution, as we saw in different recent publications. And if there is less pollution in the world, hopefully we can breathe better air. So lockdown, i.e. the decreased pollution, it may decrease the allergy rather than increasing it. The use of PPI may decrease risk of latex allergy? Probably not. Probably the more PPEs you use, the personal protection, you are at higher risk of developing allergy. So we may see an increase in the risk of latex allergy after this coronavirus goes away, hopefully soon. The last part, the use of disinfectants, does not disturb the human microbiota? No, actually this is not a true option. Probably it does disturb your microbiota in your skin. We all know that the microbiota is not only the GI, it's in the skin, it's in the respiratory, as well as the genitourinary as well. There are the other parts that we do not know. So when we use a lot of disinfectants, you are disturbing our microbiota, and we still to find out maybe in a year from now or so, we will see more of kind of skin allergies later on. But that was a good question. I like the interaction, the responses from everybody. Please feel free to put comments in the chat thing or the question, so we'll be able to answer it later on time. All right. Moving to the third point in the outline, I think we're doing very well when it comes to time. I will talk about the gut microbial dysbiosis and allergies. As we all agree, our GI system is a very rich organ. For example, our GI system, the surface area is huge. It's probably bigger than your house. It's about 300 square meters. It has most of the immune system, estimated to be 70 to 80% of the immune system. And it has trillions and trillions of bacteria. This is what's known as the gut microbiota, and probably hundreds of millions of neurons. All these are interacting and cross-talking to each other, i.e. your system is influencing the gut microbiota, and the gut microbiota is probably influencing your system. As you can see at the top of the slide, I put, you are not a human, comma, you are a walking bacterial colony. I borrowed this quote from a TED talk that was done in 2012 from the Flanders Institute of Biology. And that's probably true, as we all agree, there is more bacteria in our bodies than our own human cells there. And our job to keep everybody happy and to avoid this biosis that might have a negative effect later on. In this slide, as you can see on the left side, at the bottom of the left, there is desert. This is area with nothing in there. And this is what probably the baby at early stages in utero. Later on, and there will be some microbiota developing there. Obviously, the biggest change will be at the time of birth. As you can see, there is a huge exponential increase in the number of the flora living in our intestine. Later on, we'll talk about the idea, does the breast milk has microbiota or not? We'll discuss that later on. But as you can see at the top left, there is a forest full of the green trees there, and this is all our microbiota. In the right side of the curve, you will see the x-axis, the different age groups from babies to toddlers to adults and later on, and the y-axis, the count or the log count of the bacteria. All kinds of bacteria will increase exponentially, but more specifically, the bifidobacteria, the one in brownish color, the bifidobacteria is the most important, and that will flourish in a huge exponential way soon after birth. And this increase in the bifidobacteria is a good sign of health, that the children with good bifidobacteria and a large amount of bifidobacteria, they have a eubiosis, and this is will protect them, and I will show you some slides later on about that. A prebiotic that increases the bifidobacteria is considered a good prebiotic because it will support the growth there. I think I can skip this slide. All right, let's talk about now the immune modulation, the pre, the pro, and the symbiotic concepts. As you can see in the middle of the slide, this is a healthy breastfed baby, and in red you can see here is the bifidobacteria. Healthy breastfed babies are more likely to have a healthy bifidobacteria, while a baby with cow's milk protein allergy, they have less bifidobacteria there and more of the Clostridia bacteria there. So the flora of a child with allergy is very different than the flora of a healthy child who are breastfed and does not have allergy. And the question, obviously, you will have in your mind, which one causes the other? In other words, if you have abnormal flora, you are more likely to have allergies, or if you have allergies, it's going to alter your flora. Well, that's a difficult question, but most likely that if both of them are interactive in a way, at least from a therapeutic and management way, we can say if I improve somebody's flora, I might decrease their risk of allergy. And also, if they already have allergies, if I make their flora more favorable, more eubiosis, then I might be able to treat their allergy. Obviously, allergies are important, but more important is the long-term effect, the autoimmune disorders that I mentioned in the first few slides. This is another graph showing the same thing. In a healthy infant, there is eubiosis. The gut microbiota is healthy, while in a child with dysbiosis is more likely to have an abnormal flora like what is shown here, and this might increase the risk of having allergy, specifically cow's milk protein allergy. All right, so as you can see on the right side of the slide, this is the homeostasis or the eubiosis. This is what we should have always. If you have a good bacteria in your system, you are more likely to have a good immunity, a good metabolism, and a better gut-brain axis. While on the left side, as you can see, is the dysbiosis. When you have an abnormal microbiota in your system, you are at high risk of having allergies and, more importantly, other autoimmune disorders, and maybe even others like being overweight or obese or having a metabolic disorder. If you have a patient who's in dysbiosis, you try to get them back to be in the eubiosis or the homeostasis there. There are several ways to reverse it from dysbiosis to eubiosis. One of them by giving them healthy nutrition, healthy balanced diet. The second one by giving them the prebiotic, which supports a good healthy system. Or you can go further by doing the pharma approach, and in this case by giving probiotics, or you might go even to the fecal microbiota transplantation. Obviously, it's easier to do the healthy nutrition and the prebiotics versus than giving a probiotic or the fecal microbiota therapy. I'm gonna have to shut down my alarm here. You know, we get alarm before lockdown. Okay, fair. Yeah, so it's healthier to do it by the nutrition and the prebiotics. Another word of caution if you are giving probiotics, remember that when you are giving probiotics in a therapeutic way, it might help in certain disorders, but you cannot give all probiotics. You can give one strain, two strains, maybe up to 5, 6, 7 strains, but obviously you cannot give the 1,000 different microbiota we have in our system. While if you are giving a prebiotic, you might be able to feed, you know, many kinds of strains of the probiotics in your system. All right. Question number 4. Which one of the following is true about prebiotics? So pick the true answer. The first A is human milk oligosaccharides, or known as HMOs. Their composition are very similar among all lactating women. So if you think all women, they have the same prebiotic, please click A. B, if you believe B is true, B says different HMOs have similar functions. So all human milk oligosaccharides are the same. C, human milk oligosaccharides added to infant formula come from human source. If you believe this is true, click C. D, prebiotics have a long-lasting immune modulating effect. Take a few seconds to get everybody. All right, we got a lot of responses, and I think most of us get the right answer. Let's go one by one. The HMOs composition are very similar among women. No, that's not true. Different lactating ladies, they have very different composition. It can be related to genetics, can be related to diet, and so on and so forth. So A is not correct. Different ladies have different HMOs. B, different HMOs have similar function. I'm glad that almost nobody picked this answer, because it's wrong. Because different HMOs, they have probably different function. Some of them might be similar, but the vast majority, different ones have different roles. We know that in human milk, at least a couple of hundred different HMOs are there. C, I'm glad to see that very few, almost nobody actually have picked C, because when they say formula X has added HMOs, it's not coming from a human. No, it's not coming from breast milk. It's synthesized in the lab, so it's synthesized artificial milk oligosaccharide that's added to an infant formula. So it's not human, i.e. it's not coming from human. It resembles a human. It's manufactured in the lab somewhere. And D is the correct answer, that prebiotics have a long-lasting effect. i.e. if you give a prebiotic to a baby in the first few months of life, it will change their future and have a good positive modulation effect that will last till they become older adults. And I think Professor Meyer will share with us more about this. So a prebiotic, the old definition was a substrate that's selectively utilized by the host microorganism to have a benefit. This was probably, this is probably a good definition of that. As you can see, obviously, in this one, it says a prebiotic does not have to be a carbohydrate. It can be a non-carbohydrate substance like the inulin or others. And also the positive effect of the prebiotic is not only in the GI system, but probably outside the GI system, i.e. respiratory system and skin and others as well. And the beneficial effect has to be documented by clinical study. I'm sure you have seen this slide in my presentations before. It shows you very well that the breast milk is full of prebiotic. It's even more than the protein there. This was to answer the previous question. I think we mentioned that different ladies, they have different human milk oligosaccharides in their breast milk. Professor Meyer will talk in details about this, but there is strong evidence that the prebiotics can decrease the risk of allergies, also decrease the risk of infections, and definitely improve the stool microbiota there. And there is about more than 30 studies talking about the specific combination of the GAS-FAS prebiotic added to infant formula. All right, I think we are getting close to finishing, but let me ask you this question. Does the human milk contain prebiotic? If you believe yes, click A. If you believe no, click B. All right, most of you have picked the right answer, which is yes. Probably human milk contain probiotics. I'm sharing with you here several of the publications that have looked at the breast milk, that it does contain probiotics, whether it comes from the production glands in the breast or does it come from the skin or whatever, we are not totally sure, but most likely breast milk does have probiotics in it. All right, so which probiotic is there in the human milk? This is a publication by Soto in 2014, where he have looked at different kinds, and he found that bifidobacteria exist and lactobacillus is there. Bifidobacteria is probably the commoner one with positive effect. In particular, he found that the breast milk is rich in bifidobacteria breve. This is one of the specific probiotics that exist in the breast milk, and I have highlighted that here. The breve, you can see, have the highest prevalence if you compare it with the other bifidobacteria. And this was further published by other researchers who found that breve is probably the commonest bifidobacteria in the human milk. The symbiotic concept is actually giving the child a pre and a probiotics together, i.e. the good bacteria and the food for the bacteria, as if you are sending your probiotics with its lunch box. I love this concept because it's not only you are feeding the good bacteria there, actually you are feeding the human or the baby in this particular example, you're feeding their own microbiome. So you are feeding the probiotic you are giving and you are feeding its own. So it has a synergistic effect, and probably that's why I said symbiotics, 1 + 1 is more than 2, because you have the good effect of your probiotic you are giving and the baby's own infant microbiota there. This is why there's a lot of research about symbiotics and its importance in the gut microbiota in infants when it comes to allergy, infection prevention, or even stool consistency and functional GI disorders. I borrowed this quote from the ESPGHAN, now it's about 20 years ago, where the ESPGHAN leadership at the time thought that our job as pediatricians is not only to feed infants, but hopefully to promote their future incidence of gastrointestinal, respiratory, as well as allergic disorders in the future. So whatever you are doing for your children today, you are hopefully modifying their future by having a lower risk of infection, lower risk of allergy, and other metabolic disorders. Obviously, we know that breastfed babies, for example, they are at lower risk of having obesity and diabetes in the future, and hopefully we can affect that by giving a balanced, healthy diet in early infancy. So, Ms. Chairwoman, and dear audience, I see more than 580 people participating with us. Beautiful. I'd like to leave you with a few take-home messages. The first one, I think we all agreed, and you answered the questions correctly, that the allergies are common and probably are increasing. There is a short term during infancy as well as a long-term effect that will affect their future, And hopefully, if you give them a good microbiota today, they will have a good future and lower risks of metabolic and in autoimmune disorders. We mentioned diabetes, Crohn's disease, multiple sclerosis, and others. We talked about the role of pre, pro, and the symbiotics, and Professor Meyer will tell us more about this and the clinical implications. All these are very important. Personally, I'm more thrilled about the symbiotic because of the synergistic effect that it will have on the microbiota, and probably a greater effect on the future. And hopefully we can prevent allergies and, more importantly, the allergic disorders. With this, I will go to the questions, and I will try to answer a few of them with the limited time we have. The first question, nice topic, thank you. Sheikh Al-Suwaidan, nice topic, thank you. A question by one of the audience says, if a new mother is on high dose antibiotics, would advise to continue breast milk given the fact antibiotics may harm the baby? So if a mother is taking antibiotics, definitely I will advise her to continue breastfeeding. I will advise her to avoid antibiotics if possible, because the antibiotics, it will definitely affect the microbiota of the child in these patients. Because even a mother if taking antibiotics, her breast milk still have advantages. It's nicer if she can be off the antibiotics if possible. A word of caution here, please tell your obstetrician to avoid giving antibiotics at the time of birth. Many obstetricians, they love to give antibiotics at the time of birth. This will destroy the microbiota of the mother at this very critical time. The role of symbiotics in exclusive breastfed with colic by Dr. Azam. If a baby is being breastfed, I don't think you need to give them an external symbiotics, because the milk, the breast milk, is full of prebiotics, and I showed you some evidence it has probiotics. Probably that's a complete. But if the baby is a formula-fed baby, definitely I would consider a formula with prebiotics or symbiotics or maybe antibiotics. Dr. Radha Joshi, usually mothers complain of not getting enough milk. I usually attribute that to breastfeeding, positioning, and technique. I agree with you. It's probably the technique rather than the actual disease or supply. In children at high risk of developing food allergies, would it be an option to administer symbiotics early in life? Yes, if they are not being breastfed. Okay. All right. From Dr. Reen, HMOs in a mother breast milk does not get affected by her diet. I think it does get affected by her diet. A healthy, balanced diet to the mom will definitely make her breast milk a healthier breast milk. Because of the interest of time, I will give the stage to my co-speaker, Professor Meyer. And what I will do, I will go through the questions in more details, and I will post the answers in the chat if I can. Thank you very much. You have been a great audience, and we'll have the time to listen to Professor Meyer now. I give the stage back to you, Ms. Helen.
Thank you so much, Dr. Bigdadi.
Cheers.
For that educational and insightful session. We would like to move swiftly on to our second and final speaker for this evening, Dr. Roseanne Meyer, and her presentation, Clinical Evidence for the Role of Symbiotic in Allergy Management. Dr. Roseanne Meyer is a pediatric allergy research dietitian in King's College London, a honorary senior lecturer in Imperial College London, UK, and a visiting professor in KU Leuven, Belgium. Again, it gives us great pleasure in welcoming such an esteemed speaker to join us this evening. Up to you.
Thank you very much for this very kind introduction. And from my side also, amazing that Nutricia has allowed for this platform. And I agree absolutely with Dr. Magdani that I think this is most probably the way that many of us will be going. It's an honor to also be presenting together with Dr. Magdani. And it's so nice that we are complementing each other. And if I go through some of the slides a little bit faster, it's because some of it you've already heard. My topic today is really the clinical evidence for the role of symbiotics in allergy, and I'm going to try to make it as practical as possible for you at home. The same as for Dr. Magdadi, my format is also with some interactive questions. If you are now well trained on the system, please don't put your answers to the questions on the chat, but actually on the poll, because on the chat we will not see your contribution. And then at the end, you can, of course, during the presentation, already submit your questions, and I'll try to get to them at the end. I just want to start off with some conflict of interest in terms of academic lectures and, of course, academic grants and allergy boards as well. So I want to give you a case scenario, because all of us sit in a clinic room and we have cases, and these are the practical questions and the applications that we have to resolve where we take the clinical research that we've just heard of. So you've got a baby that's 3 months of age and has eczema since the age of 4 weeks and has developed immediate symptoms, hives and angioedema when exposed to a bottle of infant formula. Up to that age, this baby was exclusively breastfed. You perform a skin prick test. Now you have a 5 millimeter wheal to cow's milk and egg, but negative to all other allergens. And this baby has dropped by 2 centiles. So you've got cow's milk allergy and positive for egg, and has also dropped in centiles. The parents want you to recommend a hypoallergenic formula, as the mom needs to go back to work, and I'm sure it's a scenario that all of you have. So that's the baby. You've got a month of transitioning, and they have 2 questions for you, as they've been doing their research on the internet. And I think all of you can identify with that you now have parents that come to you that they have already used Dr. Google. And this is my first interactive question. Is the mothers and the fathers asking, what can they do to improve their baby's immunity when breast milk is not available? So your options here, so you go to the polls, please, is A, you do nothing. B, you avoid antibiotics and PPI use. C, use any pre or probiotic supplement. D, you use a hypoallergenic formula with prebiotics, probiotics, and symbiotics. So please submit your answers now to you that you want to have. I'm also going to poll myself and see what people are doing. Of course, there's some things that some people are more important than others. So the vast majority of you have said, okay, the way to improve the baby's immunity when breast milk not available is to use a hypoallergenic formula. And you're right, that is something that's really important. But of course, I put some other answers in here. You've already heard from Dr. Magdadi that avoiding antibiotics, and I want to add here also unsolicited PPI use is also important for the microbiome, which we really want to protect. So I'm going to ask the second question, which the mother asks you, saying, okay, now you've answered my question about immunity. What can they do to help their baby outgrow their allergy faster? So one option is that you say, actually, I can't do anything about it. Option B is you can use a hypoallergenic formula with prebiotic, probiotic, or symbiotic. You can introduce solids food as soon as they are 17 weeks, so early aggressive introduction. You can use any pre or probiotic supplement. So let's see what most people suggest with this. So I'm seeing that it's still moving. A very big percentage of you said use a hypoallergenic formula with prebiotics and probiotics. Some of you've talked about solid introduction. Some of you talk about any prebiotic. So, of course, the use of a hypoallergenic formula, and I'll go through the evidence now with prebiotics, probiotics, symbiotics, has a lot of evidence behind. But some of you talked also about introduction of solids, early introduction. That's not the aim of today's presentation, but of course there's evidence to talk about early introduction of peanut and some of them on egg in terms of prevention and the diversity of the microbiome by early introduction. But the last one, using any prebiotic and probiotic, and that's a really important message. It's not any, it's actually specific ones that you want to introduce, because only specific ones have got evidence for the prevention and also for the management and improvement of the immune system and of the microbiome. You've already had this fantastic presentation, which I just summarized. This is a fantastic recent publication by Kukowska that just summarizes exactly what Dr. Magdadi talked about, the cesarean section, the families, multiple children versus in single children, the hygiene around the antibiotics therapy, the breastfeeding, the contact with nature. And I loved absolutely the questions around coronavirus and the isolation that we're currently having and the impact. And then, of course, the tipping point with the Th1 and Th2 response there. So you've also had the evidence, which I'm not going to go around, the gut microbiota in food allergic children, and you've seen that their dysbiosis and the difference between a bifido bacteria predominant microbiome versus a more unfavorable microbiome. So I'm not going to spend time on that as well. In regards to the microbiota, you've seen also that from the data presented that actually in children that have cow's milk allergy versus non-cow's milk allergic patients are anaerobic, the microbiota changes very significantly. You don't only have a difference in the type of microbiota, but also the difference in the diversity as well. So let's get to your next question. So you've had the evidence now. So has your practice now, in terms of the dietary management, the practical dietary management of cow's milk allergy, changed over the last 5 years? So let's see the responses. The vast majority of you said yes. And I see that in my own practice. And the changes that I see over the last 5 years is in particular related to how we advise parents. In the past, we advised you just avoid the allergen. So it's the maternal elimination. It's a plain, extensively hydrolyzed formula or an amino acid formula. And you don't introduce any allergenic foods below the age of 1. But that has changed to the present, where we are now starting to look at the active introduction of allergens. We're looking at specific oligosaccharides, and you've heard the background to the HMOs. We've also looked at now starting to thinking about fragments, and we're now touching on the future, where we are actively trying to modulate the microbiome. And that is really mimicked in the hypoallergenic formulas that we have available to us now already, which I think is tremendously exciting. And the aim here, as you've heard from Dr. Magdadi, is not just to impact health now. It's about the allergic march, to think what impact can we have later in life. And that's what these parents, those parents that sit in front of you, what can I do to change the immunity? What can I do to improve tolerance? Those are the questions that the parents have in front of you as well. The first message that should come out from all of you is that breast milk is the best. And as you heard, it's a rich source in prebiotics and most probiotics as well. And part of it is also the entero-mammary pathway, where actually it's cultivated. You see that the gut bacteria you also see within the children that are breastfed, which are unique to the mother, whether that is also a transfer from the skin when breastfed, that still needs to be seen. But the best message to also these parents, a mother that needs to go back to work, for example, is, can you still breastfeed at the evening time when you come back? Can you breastfeed in the morning before you go? So it is also a message that from an immune system and the microbiome, if breast milk is available, you should ideally use it. But we also now, as I said, touch on these exciting developments in regards to prebiotics, probiotics, and symbiotics. And a very important message today is these formulas and the evolution just don't fall off a tree. There actually is an evolution, how they've occurred, and there's a huge amount of research behind them. So it started off with the first data coming out on prebiotics. And the first studies have really occurred in extensively hydrolyzed whey formulas with the addition of galacto-oligosaccharides and fructo-oligosaccharides, which are both prebiotics that are very well known. I'm here putting in succession for you 3 studies that I also have the references. It's the same study, but they've been followed up at 6 months. The children have been followed up to 2 years and at 5 years. And it showed that the children that had the prebiotics versus the children that had no formula that was supplemented had the cumulative effect on atopic dermatitis was significantly reduced. And this effect, even if they stopped on this prebiotic supplemented formula, was actually maintained up till 5 years of age, which leads back to the question that Dr. McDaddy had, saying that this has a long-term effect. It's not only now, but has a long-term effect. So that was a really good research. There are more than 30 studies just on prebiotics outside of HMOs. The last time I looked, there are more than 900 studies only on HMOs. So I'm just presenting you one study, but there's a huge amount of evidence. After the prebiotics, there's also been the effect on probiotics. Now, again, I'm just touching at the tip of the iceberg. There are thousands of articles on probiotics in regards to allergy prevention. And I'm here in particular looking at tolerance, because also parents ask, can I do something in regards to tolerance? The most well-known studies are related to Lactobacillus GG and the evidence in regards to the addition of Lactobacillus GG to an extensively hydrolyzed casein. And we have the first studies from 2013 from Roberto Canani, and then at 17, which they showed really that you had a faster tolerance development in those children that received the extensively hydrolyzed formula with probiotics, a specific strain. I can't reinforce how important it is that we're thinking about the strains. And at 3 years of age, when they looked at these children, they had less allergic manifestations, including atopic eczema, asthma, and rhinoconjunctivitis. And there's a recent study that has also come out in regards to functional gastrointestinal disorder. It's not the same study. It's a different study with children that had Lactobacillus GG in an extensively hydrolyzed versus those without. We looked at an average age of 59 months. So that's around 5 years of age, and found that those that had the extensively hydrolyzed formula with Lactobacillus GG had less functional gastrointestinal disorder. So you had evidence for prebiotics, the Goss and Fox, you have evidence for probiotics, and now we're starting to look at your symbiotics. And although we're starting to see it only quite recently in feeds, as I said, to the evolution of studying it and the impact has already been going on for 10 years. So the final product that you've got now already has got years of evidence behind it. So the Symbiotics study was already in 2010, and in particular, there are more studies, of course, I'm just presenting a couple of them, shown that in children who had IgE-mediated associated atopic dermatitis, you've seen really, and I see it shifted it a little bit. What I wanted to show you is that the score at 12 weeks, really you had a significant impact on those children that had the symbiotic supplemented feed, had much lower eczema. And keep that in mind, because we'll talk about the symbiotic feeds and also eczema and the use of emollients and skincare later on as well. So this was just the initial study already 10 years ago. Of course, all of you know when a feed has any modification, you need to establish growth. And that's what happened with the amino acid feed with symbiotics added to it. And that is, just to refresh your memory, it's a gos, phos, and bifidobreva, which you already had the background to, was evaluated by Berks already in 2015 to look at growth data and to show that children grew normally in comparison to the standard amino acid formula, and it had no detrimental effect. So that already was established in 2015. Then there was extensive research in regards to the microbiota. And bear with me, because in fact, this slide combines two studies. Although Adam Fox was part of the 2019 study, David Candy published the 2018. So David Candy's study goes up till the 12 weeks, and then Adam Fox did the publication up till 26 weeks. So what does this show? This shows, if you look at the gray kind of shaded area, that in terms of your microbiota is what you would be expecting a child that is breastfed, what would be the normative, so your reference range of what you'd want to achieve. Your white color block here is what an amino acid feed without the symbiotic addition. The gray boxes are with the symbiotic addition. So you can see within 8 weeks of a child with a symbiotic, your microbiota immediately pushes you within the remit of a bifidobacteria, what you'd be expecting of a child that's breastfed. And if you actually look at the maintenance of this effect, by 26 weeks, this effect is still maintained. On the other side, if you look at it, this is the eubacteria and also the more adult-like, the Clostridium faecalis, the adult-like negative microbiome, which you would not like. So that needs to be low. So again, the shaded area here shows you where you'd like it to be similar to a breastfed child. So you can see very quickly, you see already by 8 weeks, the microbiome already is lower in the Eubacterium rectalis and the Coccoides cluster, and this effect is maintained over a longer period of time. Further data has found some amazing further effects. When they analyze the data, and that's not only from Hugh Berks and David Candy, but also a recent abstract that was published through IACI from Chatterjee and Anna Novak was involved, that you have actually less infections, and in particular ear infections, and your use of amoxicillin has in particular come down, and you've got fewer infections requiring hospitalization. So that answers actually a question that the parents have got, and saying, what can you do to improve the immune system as well? So there are some things, and there's some research to back up when parents ask you what can be done, can say, actually, we've got feeds that have got an impact. This is also, I said to you, keep in mind when I told you about the impact on atopic dermatitis, when I showed you the SINBAD study, you will also see here, this is from Adam Fox's data, also looking at the symbiotic blend, that you've got less dermatological, so that's cream, emollient, steroids used in the children that were on the symbiotic blend. And you've already heard about the amoxicillin use, which was statistically significantly less. So let's get to our next question. Now, what practical advice will you provide the parents when you're introducing a symbiotic containing hypoallergenic formula? You've told them, okay, we've got a formula, what can we do? So an option is you just give them a formula, you go, here you go, mix it as per tin, so you give no advice. You give them also, can give you advice on how the formula tastes. You give them advice on impact on stool frequency and consistency. You can give them advice on how to mix the formula, or you can give them advice on a combination of the above. So let's see what most of you think. And I can see the vast majority of you would say, let's think about a combination. And you're absolutely right. So I'm going to give you a couple of tips that I would normally be going through when I give very practical advice. So first of all, if it's possible, even for this mother that says I have to go back to work, if she says to you, I would like to continue breastfeeding, ensure that the breastfeeding is supported. And I love the question already. Dr. McDaddy had a question about latch and positioning. That's critical. And of course, if an elimination diet is indicated, then also you need to support the mother from that perspective. So then I provide parents advice on how to introduce an hypoallergenic formula. You do need to tell them that the smell and the taste is different. Because, of course, it's different. An amino acid formula does not taste like breast milk, for example. You also need to tell them, what are you going to do? Are you going to do a direct switch? Which, of course, in an IgE-mediated allergic child, you can't just grade it because you are risking a severe reaction. Then in a non-IgE mediated, you might consider a graded introduction where you're saying you're mixing a little bit of breast milk or formula and slowly introduce it to get them used to. But in my experience, to be honest, below the age of 6 months, I rarely have a problem if I really explain to the parents. Above the age of 6 months, when taste is not so naive, you sometimes find that that is a tip that you may give. In regards to flavor additions, or if any, you don't add honey because of botulism. I rarely give sugar because sugar only changes the taste. If you want to use flavor additions, I either use an alcohol-free vanilla essence or I use a milkshake that addition that has got no cow's milk and no soya in as well. You get them on the market. And as soon as the child takes the feed, I slowly start grading it out. What about the practical advice about the symbiotic containing hypoallergenic formula? First of all, you need to make sure to say there's no harm reported if a child is immunocompromised. Of course, if a child is immunocompromised, all companies will tell you that probiotics and symbiotics, you would be very careful and is contraindicated for a child that's severely immunocompromised. A message is one strain is not the same as the other. I want to really reinforce the fact that the strains that are within these formulas are researched, they're specific. So I've also want to reinforce the fact that some data are reducing infection and antibiotic use in regards to starting some of the symbiotic use. And then critical is you need to give them advice on how to make up these feeds. A symbiotic feed, you have to make up with water that's room temperature. You can't make it up as per WHO at 70 degrees. So you have to boil the water, let it cool down to around room temperature to make it up, because otherwise you're going to kill the probiotics in there. You also need to discuss with the parents stool frequency and consistency. As Dr. McDaddy already said, we've seen some positive impacts, but sometimes you also get a bit of wind. That's absolutely normal. And of course, it's really important to explain to the parents that the reason you're giving these feeds is to change the diversity of the microbiota, which has a long-term impact on the child's health. So I'm going to leave you off with some concluding remarks that breast milk is rich in factors that promote healthy gut microbiome. So breast milk is really the best available source of pre and probiotics. You have to remember, parents are often confused about pre, pro, and symbiotics. So, because if you go into Google, my goodness, you find so much information. So it's your role as healthcare professionals to advise parents what to do. There is absolutely evidence that is published to support the use of hypoallergenic formulas that have got a mix of symbiotics, and you need to go through those evidence with the parents as well. And that's really important to pre-warn them how a formula is made up and what they can expect. I am going to go to questions. I'm going to just say, because of the interest of time, I will not be able to get to all of the questions. Let's see. We've got 77 questions. It's just loading the question. Give me a second. If we can't get the questions loaded, I might Thank you for the positive comments, by the way, from all of you. I see some of you have said excellent presentation. It's loading some further questions. So newborn babies pass the stool after every breastfeeding. How to manage such cases? So that is quite normal that newborn babies pass stool after every breastfeed. For me, that's not a problem. And to be honest, I just reinforce, unless there's blood and there's diarrhea, pain in regards to stools, it's quite normal that they have a stool after every breastfeed. So breast milk is compatible is one question. We should promote it more, in your opinion. Which brand is more near to breast milk? To be honest, there is no brand that can match breast milk. Although within guidelines, milk, all of the formulas have to meet breast milk requirements in terms to macro and micronutrients as close as possible. There is no brand that can match. So saying to any parent that breast milk can be matched at the moment is not possible. But what we're trying to do with prebiotics and probiotics is match it as far as possible. So look at the research in regards to feeds that actually match breast milk most as close as possible. So one of the questions here is, which one is more important for infants, prebiotics and probiotics? I liked the slide that Dr. McDaddy had. I think the lunchbox idea of having both pre and probiotics. I think babies have millions of bacteria, and just to provide one probiotic, I like the fact that you provide prebiotics which feed the probiotic, and you provide a targeted probiotic as well. In regards to questions, is there
I
any?
have another one. Do you also advise the mother who breastfeeds to go on hypoallergenic diet?
The answer is no. I do not go on a hypoallergenic diet. So I want to do two questions, because one is for prevention. Of course, for prevention, we say to parents, eat everything. When you talk about a hypoallergenic diet, if a mother that is breastfeeding has a baby that exhibits symptoms to cow's milk whilst breastfeeding, that is the time that I would take out the allergens, but I would take out targeted allergens. So I would work with the doctors together. If a child is skin prick positive, I would only take out those allergens. If it's more a delayed allergy, I would take an allergen-focused history. It's most of the time for eczema, it's cow's milk plus soya, but it also can be egg. So I would not certainly just put a baby on a mother on milk, egg, soya, and nut-free and fish-free. I would not just go and take everything out. I would be very targeted in regards to the allergen avoidance. Helene, if you've got questions whilst I'm scrolling down, I'm looking also at the time. I suspect I only have time for one more question.
Yes, one more. I can read you one here. How long should I give hypoallergenic formula for a baby? When to go back to regular formula? So that's a very good question. Actually, the answer is quite simple. Is when you go back to a regular formula is when a child has when you suspect the child has actually become tolerant to cow's milk. There are two scenarios here. An IgE-mediated allergy, you'd be guided by your skin prick test and a challenge. So you'd not just be switching an IgE-mediated child at home and say, just have cow's milk, out of concern of a more severe reaction. For non-IgE-mediated allergy, what we would do is we would normally do a home introduction by around 1 year of age. There's a bit of scope there. It's between 10 months and 14 months. It depends on the child. But we would certainly around that age start with a reintroduction and see whether a child then becomes tolerant. And at that stage, if a child is tolerant, and of course you would then switch over to a standard infant formula. And if the child is already above the age of 1, then a formula would not be needed anymore.
Unless I'm incorrect now, Helene, I think our time has run out. I will try to look at what questions I can still answer. I want to say we've got 135 questions here, so I am certainly not promising that I'll get through all of them. And I'm going to hand over to you, Helene, again for just a final word.
Thank you, Dr. Mayer, for another thoughtful and insightful session. I would like to put Dr. Miqdady back on because he found some important questions that he would like to answer.
All right. Well, I'd like to thank Professor Mayer and all the audience for this really beautiful session today. Actually, it's much better than my expectations. We have a huge number of audience, and the interaction is so fantastic there. During Professor Mayer's talk, I get a chance to look at some of the. I will highlight what I thought are important or frequent questions. One of the questions that I thought it's important is about breastfeeding and COVID. And the question, if the mother is COVID positive, can she breastfeed or not? Well, up till this moment, we don't have obvious evidence of transmission of coronavirus through breastfeeding. However, if the mother directly breastfeed, obviously there is a risk she might transmit the virus to the baby. But this should not be probably a contraindication of breastfeeding because breast milk has a huge advantages there. What I would suggest, if the mother is COVID positive, but she's doing fairly okay, and if she's not taking any medications that would contraindicate the breastfeeding, I would suggest to pump the breast milk and give it to the baby there. This way, probably you will get the advantages of the breast milk without getting the risk of getting exposure to coronavirus. I would love to hear Professor Mayer's response to that, if you agree with this approach.
I absolutely agree with that approach. I absolutely agree.
Okay. Excellent. So we should not deprive our infants from breast milk just because of that. And even if the baby is positive for COVID, probably that's a stronger indication to give them breast milk. Hopefully this will help them to fight the infection through different mechanisms through the breast milk. The other question I got was about a breastfed baby. Do we need to give them probiotics? Probably not. There's no studies that would show an advantage of giving probiotics to a breastfed baby, except if the baby is having an infantile colic, then Lactobacillus reuteri might be indicated in the breastfed baby, not in the formula-fed baby. So if you have a formula-fed baby with a colic, giving probiotics might not help them. Giving the formula with a pre or syn or probiotics might help, but giving probiotic drops will not help. If a breastfed baby, then it might be helpful, although in the normal baby, you would not need it. I get a question about the use of pro or pre or symbiotics in the preterm baby. There's different statement, position and publications from different authorities. I think giving a prebiotic is probably safe in the premature baby, period. Giving a probiotic, there is a lot of publication that says it can be helpful, but there is some possible risk factors associated with that. So giving a probiotic, you have to give it with caution, especially if this was a really preterm baby, or if the baby has a central line like umbilical catheter or other central, I will be careful. Another word of caution, if the baby has NEC, necrotizing enterocolitis, or short bowel, I will be a little bit even more careful in this group. But giving a prebiotic, because it does not have a contagious organism, probably is safe.
If I may just ask you, because
Sure.
I see the question is there, it's also in children under 3 months of age. And I think what is really important here is that when you're thinking about the hypoallergenic feeds, they are actually tested from birth. They're not tested in preterm infants. So when you're looking at specific feeds, you actually looking at the feeds from birth. So in the question in regards to, is it safe from 3 months? The answer is yes, from birth, it's absolutely safe to use. Use it in the population that it's been tested for. And I absolutely agree with Dr. Magdali, in regards to probiotics, as I said to you, in immunocompromised patients, and that's per general, I'd be for probiotics quite careful. And in terms of preterm infants, think also the type of feeds that you're using, what has been tested, and are the micronutrients within the feed and the protein energy ratio going to meet the requirements?
Okay. Another question, I found it interesting. Is there an indication for giving probiotics in somebody who have COVID during this COVID pandemic? Did not come across any studies that suggests to give it or not to give it. But knowing that patients with COVID, they go through this, what they call them immune or storm, I would be careful to give them any probiotics in particular, or even prebiotics, because their immune system is not at the best. So I would be very careful giving them anything if they have an active coronavirus infection. And remember that the GI is not the port of entry for coronavirus. It goes through the respiratory system. So I'm not sure if that will help them. I'm going to ask Helen to post my email there, because some of the questions, they need more detailed answer. I can answer later on with that. Last question. Somebody asked why there is a difference between the microbiota of a C-section baby and a baby with who's born vaginally. Obviously, there is a huge difference between the two because the exposure is very different. A normal birth baby, like the baby born vaginally, they're exposed to the microbiota of the mother in the birth canal and the perineum area. This area is very rich in different kind of microbiota. While a C-section baby is born in a sterile operating room, and they are exposed to the skin microbiota, which is very different. Even the skin will be disinfected before the surgery, so that will affect their exposure. Plus, a baby who's born normally is more likely to be breastfed immediately, while a C-section baby probably will be taken to the nursery and will be deprived from the mother for several hours before they get the first feeding. This is why I have totally different, and this difference probably will last for 6 months after that.
Okay, so I think we're going to close for the questions, and what we will do is that we can take a list of the question and reply to them later and send them as a post-webinar report to all the attendants. Is that okay with you?
Yeah.
That's perfect.
Okay. Yeah, and please just post my email somewhere there so people can have access to it.
Okay, we have just posted it in the questions.
Thank you, everybody, for attending and making the time.
Thank you both for this great presentation, and we would like to thank all the attendees as well that have taken the time to participate in such uncertain times. We would also appreciate your feedback on this session to help us develop and refine future sessions. A link to the feedback form will be sent. And finally, a certificate of attendance will be available and will be sent to the email address you used to access this meeting room. So we will be hosting a webinar next week, and the details will be communicated to you in the coming days. And we hope to see you again soon. Until then, thank you so much for attending, and take care.